I'm Esther Goldberg, a clinical and educational psychologist specializing in ADHD and how it shapes personality. Today, I'm going to talk to adults with ADHD about the difference between ADHD and Narcissistic Personality Disorder, NPD, two conditions which are completely different, but are often confused. They're completely different at the core, but on the outside, perhaps they can look similar, and that's why I want to talk about it. ADHD is about internal struggles with functioning. It's a neurodevelopmental condition that affects how someone manages his attention, his impulses, and his emotions. People with ADHD often work much harder than others just to function in everyday life. They can be highly intelligent, yet struggle with staying focused, keeping track of tasks, and staying organized. The shame comes from the fact that despite their best efforts, they frequently fall short of expectations. The shame is tied to their frustration at themselves, at not being able to keep up, often feeling judged by others as lazy, crazy, or unfocused. In total contrast, NPD, or Narcissistic Personality Disorder, is about controlling others. People with NPD have a fragile sense of self, and they have to protect it to control how others see them. They seek admiration, validation, and dominance over others instead of struggling with personal tasks and internal conflicts like someone with ADHD. People with NPD focus on creating an image of superiority. They use grandiosity and endless manipulation to mask their internal vulnerability and shame. The shame they feel is deep and hidden. It's not about personal failure or frustration. It's about wearing a mask to avoid constant deep fear of being seen as adequate or exposed for who they truly are. They rely on a fragile sense of self that needs constant reinforcement from external sources, constant adulation. So, why is it important to understand the difference? I'll repeat briefly to help you recap. ADHD affects how people function. It's about staying on track, managing times, regulating themselves, their emotions, and their relationships, despite feeling overwhelmed. They feel ashamed of themselves because they try and still cannot meet expectations. On the other hand, NPD isn't about struggling with functioning. It's about creating a perfect image and controlling others to avoid the deep hidden shame that comes from insecurity. They don't want others to see them as they truly are and will do everything, but everything, to avoid exposure. When we confuse the two, we risk misjudging someone's struggle. ADHD is not about being lazy, crazy, or self centered. It's a real neurological condition that impacts somebody's ability to function in certain areas of life. NPD is not about personal failure. It's about using manipulation and wearing a mask to avoid facing a deep hidden vulnerability. Understanding the difference and recognizing the role of shame is crucial. Let's stop mislabeling and start understanding. ADHD is about difficulty functioning in everyday life and despite constant efforts still failing. ADHD is not about lack of ability. It's about not knowing how to do what you perceive yourself capable of doing. NPD is not just a cluster of personality traits. He's proud, he's entitled, he's competitive, egoistic, selfish. It's about something much deeper. It's rooted in complex struggles to maintain a false sense of self and avoid exposure with endless manipulations. I hope I made this clear. I'm sorry I've repeated a bit, but I really want to get this message through. Let's build more empathy and understanding and not judgment. Thank you.